From the pandemic front line to the picket line, nurses say they were left with no option but to strike today.
Exhausted nurses and midwives walking off the job.
It's just not sustainable.
From the southern border,
Can't see a good future if this is the way it's going to stay.
to the north coast.
We're not going to give up until we get ratios and to be able to provide safe patient care.
I can tell you, after attending multiple rallies today, the people on the front line of our healthcare system are saying there is not the right number of staff, the current system is not working, and there needs to be an urgent overhaul before this crisis gets a whole lot worse.
I've looked up to over 30 patients in the waiting room, and it's just impossible to provide good care to that amount of patients.
Because our community does deserve better. It shouldn't be touch and go. We can't be everywhere all the time, checking on every patient when there's not enough of us.
We stretch and we bring patients offloading into the department without thinking whether we've got beds, we've got staff. They don't think of anything, and we just had enough.
The evidence is clear. This is not a radical concept. Queensland, Victoria, South Australia, ACT all have ratios. New South Wales is falling behind. We want ratios, safer workplaces and fair pay so we can provide the care that our community deserves.
Stand up, fight back! Stand up, fight back!
Poor shortages, no available beds, negotiating diverts, missed breaks, working across two labouring women, delivering ward midwives deserve better, the women deserve better. The state government used us to achieve high testing and vaccination rates, and how did they do this? By exploiting us and our traumatic experiences at the peak of the pandemic.
We won't take it anymore!
We want a ratio and pay rise. Is it right?
Yeah!
Give us safe staffing ratios in legislation, and we need a pay rise to be able to draw nurses to this profession, to be able to hold on to the nurses we are. I cannot express how many we are losing.
5, 6, 7, 8. Patient safety cannot wait.
As a midwife or an enrolled nurse looking after up to 9 mothers. Now included in that is 9 babies. The government doesn't think babies count. They don't count babies. We're doing hearing tests, newborn screening, sugars, observations, trying to help with breastfeeding. And that's not fair and it's dangerous.
We are desperate here in the bush. We're desperate to get ratios, and we need to be heard by this government. We have not been listened to. It's getting so dire. I just don't know why they won't come to the party. I look at what's happening in Victoria, how they're looking at incentives to actually give scholarships to new nurses, that their wage increases in Queensland, and we're doing nothing here in New South Wales. Okay guys, it's time to get loud.
You want to do a good job, you want to help these people, you want to see progress, you want to make an impact on someone's life, but at the same time you feel so drained, emotionally upset, frustrated that your system is letting you down.
Put your hand up if you've been short-staffed in the last month. Shame.
What I'd like to see changed is a government that actually is accountable for healthcare. I want to see safe staffing on the floor, in EDs, on the wards.
2, 3, 4. We won't take it anymore. What's the for?
We've asked nicely, we've played nicely, we've done the overtime, we've done the extra shifts, we've come in on days off, we've done all of those things, and now we're saying we're not doing it anymore.
Say something now. Enough is enough.
We know the current system is broken, that our workloads are unsustainable, and that the underlying issues have been there long before COVID. We know that the pressures on the system are only going to increase.
I'm sick of working short staff. I'm sick of putting patients at risk. How many times have I had to miss a meal break because there's no staff? It's time to take action.
In my entire career, I have never seen this profession so broken and so dejected.
We will be here, rain, hail, pandemic or shine,
to fight for a safe and sustainable public health system, and this government needs to implement ratios now.
3, 4, we won't take it anymore. 5, 6, 7, 8, come on, don't negotiate.
First and foremost, it's about community safety and getting more nurses on the floor.
We are short-staffed because, like everywhere else, staff are leaving the profession. We are expected to do more and more and more with less and less and less and still be responsible.
When I first started in my new grads, in 3 months, I was already put as an in-charge nurse with no experience. It was probably the most stressful experience of my life.
What do we want? Ratios! When do we want it? Now! What do we want? Ratios! When do we want it? Now!
We clearly have support from our community. We need support from our government. This is unsustainable.
We're angry, we're tired, we're exhausted. We can't give our patients what they need and what they deserve, and we're sick of it.
Do we have to work like the third world country because that's what we're doing? Our system is dying and no one is listening.
The fatigue is carrying on over into our family lives, and it's just so hard.
We all know things are going wrong, and I'm sick and tired of management telling the Ministry of Health that we're coping. We're bloody not coping.
This is a 24-hour picket line, so we're going to be here till 7 a.m. tomorrow morning.
Tim, we have the New South Wales Premier on the show within the next half hour. A message to him?
My message to him is the New South Wales healthcare system is failing. It's in free fall, and we need your intervention to stop it.
You should never be in a situation where you're having to decide which patient gets care, which patient misses out, which patient might not go home. This is over, and we will keep taking action until this government listens.